Can you imagine your life where money is your friend, working with you to achieve all your dreams and desires? If you struggle seeing money as your friend, then join Kathy Cook Noble, financial advisor and educator on understanding how your money can work for you. It is possible. Now, here is Financially Speaking with Kathy Cook Noble.
Hello, everybody. Welcome to Financially Speaking. I am your guest host, Karen Cook. And today we are talking about our health care. Does your health care make you sick? Can you afford to get sick because of the health care you do or don't have? Do you actually have health care? Do you know what's covered? What isn't covered? What's going to be your out-of-pocket expenses? Will your health care actually cover you when you're sick? How much will it cover you? Can you benefit from being sick? So we're going to look at some of those pretty serious questions and concerns today because let's face it, we all get sick. I know one of you are out there going, I don't get sick, I never get sick. Never, never, never. Good for you. That's awesome. You must have one heck of an immunity built up in the body. So congrats. I was in healthcare very long. I started out as a healthcare aide, so that kind of ages me because they're called PSWs today, which are support workers. The program is a lot longer. They have more skills. But basically, it's the same kind of job in that you're helping people in healthcare facilities that can't do their activities of daily, whatever that may be. And then I progressed to a registered practical nurse, then ended up getting a Bachelor of Arts in Psychology and Sociology, became operating room technician, or scrub nurse, I guess that's more of an appropriate term that people might understand, and then got my master in education, so I ended up teaching in healthcare. So I've kind of a little bit in the healthcare field, but I've helped unhealthy people. And yes, I've probably built up immunities to diseases or issues that have come up, but yes, I've caught some things too. So some are contagious. So I have experienced illness. And my health care, I'm in Canada. I'm very fortunate that we have a health care system, that it covered my doctor's visits. But guess what it didn't cover? Oh, you know it. I know you're yelling it out loud. It didn't cover prescriptions. It didn't cover me being off work. It didn't cover me buying or making, well, I didn't make it because I was sick, but chicken noodle soup. Didn't cover me buying my ginger ale, my Vicks, my Vapor Rub, my candies, my Buckley's. That tastes so good, but yes, it works. Whatever medications we get to help keep us healthy or to help us when we're sick, are they covered? They're not covered. Not under our Canadian healthcare system. Even if you want to try and prevent being sick, Cold FX, people use things to help them and boost. Great. I have people that swear by that. So it doesn't get covered, does it? So you're off work, you're sick. Still got to pay your bills. You still have to maintain your household. You still have to take care of your kids, whether they have 2 or 4 legs. Mine have 4 legs. Guess what? They can't even open a door by themselves to go out. And when you've got it coming out of both ends and your head is spinning and you can't breathe and you can't speak, it's awful to have to move around and try things. So can we actually afford to get sick? Or does thinking about getting sick make us sick? What does worrying do to your body? It stresses you out, right? Illness causes disease. Worrying is a horrible emotion. And if you're in the United States of America and you don't have health care, that could cause you to be sick because your health care will make you sick because you don't have any. And you worry about that. So how many of you out there have actually ever worried about how you're to get healthy or stay healthy? How are we going to stay healthy is the main. If we're not, how do we get there? Has your doctor ever recommended to you, this is my favorite, diet and exercise? Well, if you lost weight, your back wouldn't be so bad. If you lost weight, your knee would be better. If you lost weight, your blood pressure would go down. If you lost weight, you'd feel better. If you lost weight, you'd be more healthy. That seemed to be many years ago the phrase people heard a lot of, eat healthy. Did you ever hear the Mediterranean diet? Have you tried this diet? Have you tried that? I've heard it all from doctors. I've heard it from people who have told me, my doctor said to do this, to do that. Easier said than right. Because if that is your habit of the way that you eat and the way that you exercise, it's not just a matter of changing it. It's a matter of psychologically changing the way that you are, which is very difficult because it's rooted in you. I'm not an exerciser. I will never join a gym again. I hate it. I hate working out. I have a bad back. If you've listened to any other shows, I won't go through it, but you know the injury. But yes, I'm not supposed to do that stuff. And a lot of people aren't exercisers. I see that. I know that, and that's fine. There's nothing wrong with that. I just think, why would I join a gym to stand on a treadmill when I can take a walk outside? Why would I join a gym if I can go for a bike ride? But do you do it? I don't do it either. I walk my dogs every now and then, but I got 3 Shar-Peis, 42, 52, and 55 pounds. 3 of them, I might be going for a little dragon ride behind them and scuffing up everything that's not everything touches the ground. So we have a nice yard fenced in. They do that. So I walk the yard. It's only a quarter acre, but I walk it a few times a day, right? So I try and do some things, but I did join the YMCA. Love it. I'm in the pool doing aquafit 3 to 5 times a week. I do turf room. I do some exercises on the ball to strengthen my back. Then I go for a dip in the pool. So I exercise 3 and 5 days a week. Okay, nothing wrong with that. Takes the pressure off. If you like the water, even if you don't swim, you can't swim, there's all sorts of aids there to help you stay afloat. So if you have an injury, that's a good way to go. Or any kind of pool. Hospitals, sometimes physiotherapy pools, sometimes they're salt water, a little heated, nice on the bones. So if it's an arthritis situation, aches and pains, you can certainly do that. And really the membership might be between $40 and $60 a month. It is worth your health. And I swear by it. I've been at the now for close to a year, and I just swear by it. My health feels better. I'm losing a little bit of weight, which was not the goal. That's a benefit. So I diet and exercise. Isn't that supposed to do? Not diet as in diet, watch what I eat, starve myself, puke it all up, take laxatives. Not that. I've changed the food. I eat more vegetables. I eat more fruits. I eat more lean meat. I eat less carbs. That's just my choice. And that makes me feel better. So I have health care, but I don't want to get sick because my whole routine's off, right? So would yours be. You don't want that. And if you're like millions of people out there, you're struggling to find health. You're going to need a lot more than diet and exercise. It's mindset. When I joined the gym, when I used to go to the gym, and I did it a few times to lose weight specifically, and I'd suffer, believe you me, I'd be taking my hydromorphone, my Flexeril, my naproxen, go to the gym, work out, come home, have a bath, be in tears. The pain, the absolute excruciating pain, it wasn't worth it. After aquafit in the pool, I don't have that. I feel good. You have no idea. And for those of you that have done it, you know it works. And the doctors and specialists told me you should be in a pool. I said, can you write a prescription? Maybe I can get it paid for. Haven't met any company that'll buy you a pool for your back, including ODSP, WIB, and all those guys. So it doesn't work that way. But diet and exercise, don't focus on that. Just focus on yourself. What makes you happy? You're going to go crazy against the mindset of disease. We don't want to get sick. And if we worry about it, we're going to get sick. If we're upset about it, we're going to get sick. If you can't go past that, it's going to paralyze you. There are health insurance companies out there. There are government health programs, drug companies, conventionally trained specialists, and they're all integrated to kind of keep sick or unhealthy. What happens if we're all healthy? What happens to healthcare? What happens to the research? What happens to the doctors, the specialists, the surgical teams? What happens to recovery? What happens to intensive care? What happens to surgical ward? They're gone. We won't need it, right? So that's a huge field. So we want to stay healthy, keep ourselves healthy, and do what we feel is best for us and be positive, right? So let's look at how this all works from a perspective that we don't often look at, the big picture. And we don't focus on the big picture because we focus on ourselves. We focus on our lives. And there's nothing wrong with that because if you don't, nobody else is going to, right? So you have to. But let's look at the big picture. In health insurance companies post $4 billion with the B, $4 billion in Wall Street profit every quarter, saying business growth across all sectors. $4 billion in healthcare because of sick people. Sick us. I'm sure many of us have been sick this year. Health insurance companies, they increase premiums to beneficiaries, decrease reimbursements to doctors, and deny covered care, citing pre-existing conditions, exclusion of services as their fundamental reasons. So if you've bought life or health insurance and you had a pre-existing condition, was it excluded? Sure it was. My health care, my medical care, I didn't have it when I was injured. It's all over the record now. I had to say I had an injury. I had to go through WSIB. I had to see my doctor. I had to see a specialist. I had to see physio. I saw chiropractors. I saw everybody, did everything I could to make myself better. There's records everywhere. Now it's excluded. Lower back injury. So anything related to my lower back will be excluded off a claim because it's a pre-existing condition. So I pay that for the rest of my life, physically, mentally, emotionally, and now financially. So it is good to look at insurance before something happens. I know in Canada you're thinking, I have insurance. What are you talking about? Exactly what I said. Not everything is covered. So your health insurance that you purchase can cover some of the things that aren't. What if you need a back brace? A doctor can write a prescription. Your insurance company might cover that. What if you need a cane? What if you need a walker? Might not be covered. So you get these things. What if you need special apparatuses in your bathroom, your home, grip rails, non-slip things, certain shoes? I mean, shoes, TED stockings can cost you hundreds to thousands of dollars, and they could be covered. And if you're in the United States, this goes for you guys too. This health insurance, your private medical and health insurance will cover this stuff. And if you don't have health in the United States, find something. Okay, and we will talk about that later on in the show. So insurance companies, once something happens, you know how it works. It doesn't matter if it's car, house, home, dog. My dogs, I had insurance for them. Mine are Chinese Shar-Peis. Doesn't cover eyes, doesn't cover ears, doesn't cover skin, doesn't cover gastrointestinal. I'm like, okay, well, that's the four main things that I would need done. They're excluded because that's the main problem with Shar-Peis. So you really have to watch if you're getting health insurance for your pets too. But for yourself, if you have nothing wrong with you, go get insurance. Go tomorrow, get up tomorrow, go find insurance before you get sick. And if you've already gotten sick, look into it anyway. Find a financial advisor. Your regular host of the show, Kathy Cook Noble, fantastic financial advisor. I go to her for everything. I have all my insurance because of the information she gave me. So pre-existing conditions can be a problem. They could be excluded. So if you have nothing, go. And even if you do, it doesn't matter because only that's excluded, not anything else that could go wrong. So insurance companies segment the market into healthy people, which is about 80% or more, who can pay for you. You can pay for your stuff. Then there's the not so healthy people, which are 20%, but we can't afford health care. So we really have to look at how we can afford to take care of ourselves because out-of-pocket expenses are much more costly than your insurance that you're going to pay monthly. And you can find insurance. The more issues that we have, the more you're going to want to have insurance. We are living older today, but getting more problems, so we don't want to do that. What if you had to have cardiac bypass? What if you had to have heart surgery? What if it's a non-emergency? What if you want something done, an elective that is a reason? We're going to pay for that, right? Elective surgeries, things we want to have done. So we might pay for that, unless we can bring it back to a medical condition. So the insurance company is fantastic to be there to help us through our financial advisor who will help you get the beverage that you can. So on that note, let's go into our first break. When we come back, we're going to continue talking about insurance companies. You are listening to Karen Cook on Financially Speaking on the Inspired Choice Network. We'll be right back.
Too many of us get caught up in the unreal lives of reality television and complete to acquire stuff, which is setting us up to accumulate lots of debt. We're scared, confused, and don't know who to talk to. By tuning into Financially Speaking radio show with financial advisor and educator Kathy Cook Noble, you'll learn tips you can use to improve your financial health, which in turn can improve your overall health and make for a very happy life. Live a life you can afford and enjoy. It is possible. Listen for Financially Speaking radio show every Monday at 4 p.m. Eastern Standard Time, 3 p.m. Central, 2 p.m. Mountain, and 1 p.m. Pacific on InspiredChoicesNetwork.com. This is Financially Speaking Radio Show with financial advisor and educator Kathy Cook Noble. To participate in the program, call in the U.S. 815-880-8255, Canada 613-800-8736, or Skype us at Inspired Choices Network. You can also make the choice to ask or comment by email by sending to Kathy at bookkeepplus.ca. Now back to the program.
Welcome back to Financially Speaking. I am your guest host today, Karen Cook, and today we are discussing our health care and how it may or may not make us sick. So, question, are health insurance companies really interested in keeping us healthy for the long term, or are they more interested in their short-term views of their next quarter's earnings? So what's the bottom line? I always used to think healthcare, people, bottom line, that's it. It's all about the people. But it never is. It's always about the money. Everything's about money. I understand that every person, every company, everything has to make money. Money is what makes everything work. I get that. But do we forget we're dealing with people? We're all people. But are you a person? When you go to the hospital, are you a person or a number? For an insurance company, what do they ask you when you call? Oh, hi, this is Karen Cook calling. I'm calling about my policy number. I'm a number because numbers are money. So they pull it up. They know my name. They know all my personal information. They know the policy I have. They know what I pay per month. They know everything. So I understand that everything comes down to money, but it being the only issue. Is it being the sole purpose? Are we, as the insurance company, only looking at the small picture? What's the big picture? We are. So when money is in short supply, insurance companies really invest in long-term payments of aggressive integrated health programs. Or are they trying to keep their financial noses really above the water? And let's face it, when you have an insurance claim, when you hand it in, do you just get what you ask for? When I was first injured, I had to fill out those WSIB forms. For 6 weeks, I tried to call the adjudicator. That's the person who's supposed to take over your case. I had to call in, speak to a manager. She called me back about 10 minutes later, and the first thing she said to me, oh, hi, I'm so-and-so, and how do we know that you didn't lie about your injury because you didn't fill out an incident report the day it happened? I told her I didn't fill it out because I didn't want to deal with WSIB. And people like this tried to avoid it. My doctor told me to fill it out. There were 2 witnesses. Everybody saw it happen. They backed my story. They're in the report, but that's how it started. So you can imagine the fight I had for the 2 years I had to deal with her till I finally gave up and thought, you know what? It's the mental stress. I see why people get stuck in a rut because, to me, they did everything they could to keep me down, to try to get me off the program. So they're not just giving you money out because you need it. How about our system right now? We have millions of aged people who are now burdening this stress system, right? The baby boomers, holy cow, never had anything before or after that. We have hundreds and hundreds of thousands of people becoming the age where they're going to need more health care, more health coverage, more injury, illnesses, disease, issues, complaints, pains, moans, groans, going to see the doctor more, going to visit hospitals more, physio, healthcare facilities. So if you're healthy right now, are you going to stay that way? And how are you going to stay that way? You are the target group that needs to pay for disease care now. They're targeting anybody that really isn't the baby boomer. We're the ones that are helping keep the system going because our money is going to be siphoned in the form of premiums and taxes at escalating amounts, which is going to decrease our ability to engage in health habits, quality nutritional counseling, preventative body work, rehabilitation, fitness memberships, personal trainers, psychological counseling. Might not be able to afford that, right? It's called a budget. We might be if we figure it out. But again, if you don't have the money, you're not a well person. You just don't have it. So to look at making sure that we have the best possible health care at the best possible cost. So speak to a financial advisor that you trust. So government programs for health, Medicare, for example, is a great example of what will happen to healthy vision, to the healthy in the future. So about 10,800 Medicare recipients qualify for the program per day, or 4 million baby boomers since the year 2010. Medicare will be insolvent once the remaining 64 million baby boomers qualify into the program. Federal deficits are estimated at, get ready for it, boom, 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 $16 trillion. Trillion. I don't even know how much money that is. I get a billion, a trillion past that, well, 16 of those. Is that like 160 billion? Ugh. But when unfolded entitlements like Medicare and Social Security are included, the total is around 211 trillion. Ugh. Wow, eh? Phenomenal. The baby boomers are the biggest set of individuals ever. Right? So this is going to be a concern on the healthcare system. So in order to pay for programs which are imploding, the government will have to tax healthy and young individuals and funnel that money into disease care now. Because if we don't do that, we're not going to have any care. So we're going to cure cancer has become a wonderful, let's say, dream. And it tugs at the heartstrings. Open your purse, give out money. That's fantastic. That's what we want. We want to research things to find first. The National Cancer Institute 2012 report to the nation of the status of cancer says cancers are associated with being overweight or obese. Several of these cancers are associated with not sufficiently being physically active. But instead of money going towards aggressively correcting behavior, raise it for endless research. So are we helping the wrong end? If being overweight and obese and unhealthy and not exercising causes cancer, shouldn't we be focusing on or causes some cancer? Sorry, don't get excited. It doesn't cause cancer. Can cause some cancer. Should we not look at changing the behavior of the person instead of trying to find the cure after the fact? And I'm not saying there's anything wrong with cancer research. It's a great thing. We've come a long way in our research, absolutely. But we've still got a long way to go. And should we be helping people preventing more disease than curing it after the fact is what I'm saying. So conventional medical specialists are incentivized to cut, fix, prescribe, and test. Working in the operating room during surgery, surgeons get more money the later the night goes on. When we used to get called in at 3 in the morning, at the same pay. They got like 4 or 5 times the amount of pay. Granted, it has to be an emergency, and that happens. But they get money to do procedures. And I've never met a bad surgeon. Surgeons were great that I worked with. Never worked, well, yeah, they were good. So, but that get paid for everything that they do. So the healthcare system pays to fix us during and after things. But what's happening before? Preventative measures. They're paid to search, find, destroy disease. The more specialized they are, the more disease-oriented their mindset, working backwards to find the cure. Right? Let's start at the beginning. So specialty experts in disease. Their recommendations will be disease-focused under the guidelines for the prevention of disease, rather than operating inside a paradigm of health first. So it doesn't matter about keeping you from the doctor's office. Like I said, money's the bottom line. So if you never go to the doctor, they don't make money on you. So do they want you to have proper exercise, to eat the way that you should, to stay healthy? Because then they don't make money. They don't see you. And I'm not saying it's a conscious thing. It isn't. It's just the way the system is. We fix you during and after. We don't prevent for most things. There are some things we can prevent. We'll talk about that. So when you call your doctor's office, you make an appointment, what do they say to you? Why are you coming in, right? Oh, they have to know the reason why you're coming in to book the appropriate time slot, and they put in these codes. These codes go in the system that tell the government or the insurance company how much money they're going to get. It's called an ICD code, an International Classification of Diseases. It's a coding system, which is the creed of the medical profession. And believe it or not, there's 144,000 different codes. So all bookings are done according to the code. You call, you give them your reason, they book you accordingly, and they bill the government or insurance company for that code. So when you go in, by the way, I have this, make another appointment, because they don't get paid. Some doctors will listen to you, and they'll have you come back. Because I get it. I've been in the healthcare field. Everybody should get paid. I understand that. But then I would have to come up with another problem so that they get what they deserve, and they do. But what if that problem, maybe I can't get in for a month, causes a severe issue? See, preventative, during, and aftercare. So we are trained to believe that the absence of disease is the equivalent of health. So here's the question. Can you separate yourself from a disease-oriented medical system to find optimal health when all these perimeters, including health insurance, government programs, drug companies, and doctors, perpetuate disease via their beliefs, thought, training, messages, and actions? We kind of just go with the flow, don't we? Things that make you go, And I'm not saying it's a bad system, but are we focusing on the end? We're kind of in a downward spiral, economically, physically, emotionally, spiritually, health-wise. The more we focus on disease details, the more we desperately slash through the forest without seeing the trees. The sicker we will all become. So no amount of money will ever solve the problem, because the problem is the way we see the problem. Change is the way you see things. Push aside what you've been told to believe against. Opposition, vilification, condemnation. And only then will we be able to find optimal health. Optimal health is where you want to be, where most of you are today, where I pretty much am today. Today, right now, talking to you, I feel good. I don't feel sick. I feel healthy. I don't have any aches, pains, and if I do, they're very minimal, so I can't complain. Doesn't matter anyway. So you want to be healthy, physically, emotionally, financially, spiritually, and health. Optimal health is being the best you that you can be. So at this point, let's go to our second break, and when we come back, we're going to talk about specifically Canada and what is covered as far as healthcare goes in Canada, because not everything is, right? We can go to the doctor, we can have what's deemed necessary or emergency surgery, but let's talk about what is and isn't covered in Canada. Then we're going to talk about the United States as well, because I'm sure we're traveling back and forth, maybe vacationing, and we have listeners in both countries. You are listening to Karen Cook on Financially Speaking, the Inspired Choices Network, and we will be right back after the break.
Too many of us get caught up in the unreal lives of reality television and complete to acquire stuff, which is setting us up to accumulate lots of debt. We're scared, confused, and don't know who to talk to. By tuning into Financially Speaking radio show with financial advisor and educator Kathy Cook Noble, you'll learn tips you can use to improve your financial health, which in turn can improve your overall health and make for a very happy life. Live a life you can afford and enjoy. It is possible. Listen for Financially Speaking radio show every Monday at 4 p.m. Eastern Standard Time, 3 p.m. Central, 2 p.m. Mountain, and 1 p.m. Pacific on InspiredChoicesNetwork.com. This is Financially Speaking radio show with financial advisor and educator Kathy Cook Noble. To participate in the program, call in the U.S. 815-880-8255. Canada 613-800-8736, or Skype us at Inspired Choices Network. You can also make the choice to ask or comment by email by sending to Kathy at bookkeepplus.ca. Now back to the program.
Welcome back to Financially Speaking. I am Karen Cook, your guest host, Financially Speaking, and we are discussing how our health care may or may not make us sick. So let's about Canadian health care. So Medicare is Canada's publicly funded health care system. So instead of having a single national plan, we have 13 provincial and territorial health care insurance plans. So the Canadian government ensures the quality of care through federal standards. The government doesn't participate in day-to-day care or collect information about your health, which remains confidential between you and your doctor. Canada's provincially based care systems are cost-effective because of their administrative simplicity. In each province, each doctor handles the insurance claim against the provincial insurer. So you never have to pay a pocket. As long as your health card is up to date in the province or territory you live in, you show the card, it's not expired, you get coverage. Even if it is, usually you can apply to give a call to the number and they'll tell you how to get your card back on. That's basically all it is. I mean, the old red and white ones didn't expire until I had to get the new one. I had the red one because it never expired. I think it's been 2 years now, but I don't know if they still accept them. So each part is a little different because it's the same because every doctor goes to the insurer, whether it's private or Canada, and they get the money. So you don't have to worry about money. Private health expenditures account for about 30% of healthcare financing. So 30% of people have health insurance, yay for you. So the Canada Health Act does not cover prescription drugs, home care, long-term care, dental care, and anything over the counter that's not a prescription. So if you like the vaporizers, the heating pads, the VapoVix rub, your Vicks cough drops, Fisherman Friend cough drop, gosh, I had them once, woo, Buckley's, whatever, FX, not covered, right? So Canadians rely on private insurance from either their employers, which again makes sure that you're covered, whether you're sick there, do you lose it if you're off, you are set off with your job, so you're laid off, are you covered? So, and of course, we look at our own private insurance. So the provinces do provide partial coverage for a lot of our health care. Obviously, adults, children, poverty, seniors, it's covered as long as you have your health card. But not everything is. So competitive practices such as advertising are kept to a minimum. So it maximizes the percent of revenues that go directly towards care. We don't see a lot of advertisements on TV about the healthcare system. It's usually about an issue, right? Smoking, drinking, marijuana, whatever the case is. So costs are paid through funding from income taxes. So you might go, where the heck does all my taxes go? This is where it goes. And that's a good thing. We want that, right? So there's no deductibles on your health care, no co-pays. You never have to pay anything. Okay, I know sometimes I do, but related to your health. Sometimes you need doctor's notes or you need things filled out. So some physicians charge either a fee for service, annual fees, part of a package. You can pay a year for your family. And sometimes you have to pay for things. Missed appointments, doctor's notes, prescription refills. So you can either pay the full fee. If you were injured, it's paid by your WSIB. If you're on any assistance, ODSP or Ontario Works or some kind of system, it should be paid for. But again, if you have private insurance, it could be covered too. So health card, you get a health card from the Provincial Ministry of Health. It's your own unique identifying number. Everybody gets the same plan. Now, Quebec's a little different. They have a little bit of a different system, but still they have coverage. So any kind of necessary care that you need to be covered because of your health card. So Canada is one of the few countries with a universal healthcare system that does not include coverage of prescription medication. We have all that coverage. Medications aren't covered. Now, if you're below or above a certain age, they could be covered or a lot less money. If you're on government programs, they're probably paid for. But again, if you're not, you're the average norm, 21 to 60, you're probably paying for that medication. Quebec's a little different. People who are covered by the province's public prescription drug plan pay an annual premium of $600 when their Quebec income tax return. The rest of Canada, we don't have that. So we don't pay for our healthcare service. So pharmaceutical medications are covered by public funds in province for elderly, indigent, or through employment-based private insurance, or paid for out of pocket. More than 60% of prescription medications are paid for privately in Canada. 60% of your meds paid for privately, which means if you don't have insurance, you're going to pay out of pocket. I don't know about you, but one of the medications I took cost me over $100 a month, just one. I'm like, is there a substitute? And you know what? Unfortunately, there wasn't one for that because that was a great medication for pain. Not anything that's too addictive or that I got addicted to. Nothing like that. It was non-addictive, but it was a great pain medication. But $150 a month, I thought I can't afford that. And I know you're thinking, well, shouldn't WB pay for that? You were injured. Yeah, I know, but I kind of opted out of that because I couldn't deal with it. So I made my choice. So I have the Y. I have my jiggle machine. I got nice. I got my radio show where I get to sit in my comfy chair with my dogs on my feet having a chat with you. and I have my medications. So yes, I've made it work. So family physicians in Canada are your doctors you apply to be with, and you do apply for your family physician. In Canada, you are legally only allowed to have one doctor. You can't see more than one physician at a time. If you need to see a specialist, that's who refers you. If you don't have a doctor, you go to a that doctor will refer you. But in the United States, if you aren't adhering to a national health care plan, you can see any doctor you want. But it's a good thing. You might like a certain medication. So you might go to 5 different doctors to get that medication. That's not a good thing. You don't have to tell the other doctor, and they are not legally responsible for you to have to tell them what other doctors you go to. But I have to say, it's not a system. If you do this in Canada, you can be kicked out of the healthcare system, and the doctors can refuse to see you, so you have a doctor, which puts a bigger burden on the emergency rooms. How many hours of wait, at the least amount you ever waited at an emergency room? I got injured at the hospital I worked at here in my town. No special privileges. 3 to 4 hour wait no matter what. And sometimes you can't stand that. You're in too much pain, and you're not considered an emergency. So, and if you're going in because you need to see a specialist or you don't have a doctor, you're wait too, right? So we definitely want a general practitioner. So preventative care and early detection are considered critical, and yearly checkups are meant for everyone, and they're covered in Canada. So you really do need a doctor. In the United States, the Affordable Care Act accomplished 2 main goals. It provides affordable health care insurance to more Americans. It was to change the health care delivery system, improving the quality of care while controlling costs. The life expectancy changes no matter where you live. It depends on many factors, not just your genes or where you come from, your hereditary issues. It deals with disease. It deals with preventative measures. It deals with diet and exercise. It deals with libations. So it's a little different everywhere. But just to let you know how much longer you can live in the healthcare system versus worrying about one that you don't have, in the United States, the average life expectancy is 79 years, which is actually lower than comparable countries. It's 82 years in comparable countries. So Canada is 82. I know you think 3 years, big deal. Hey, man, that's 3 years. If I can get 3 years more on this, I'll take it. So the ACA, Affordable Care Act, has managed to provide health care coverage to Americans, but yep, still a lot of work to be done. The cost and quality of health care that everybody receives and anywhere you are, everybody should receive the same. How about infant mortality? In the United States, infant mortality rated 169 out of 224 countries. What if you have a sick baby? What if you have a baby? It can cost you over $10,000 to have a baby. That's just to have it in the hospital. In the United States, not the pre and post care. God forbid you have a sick baby or ugly baby or child. Can you afford to take them in? A survey, 11 countries found that United States adults are sicker than their counterparts abroad and more likely to have problems paying their medical bills and getting needed health care. U.S. adults report difficulty getting care in a timely fashion and using emergency departments for issues that your general practitioner treat. We do it in Canada too. A lot of Canadians don't have a doctor. And going to Emerge is the option, or an outpatient clinic, which only takes clients every now and then, right? So it's important that you find and keep a doctor. Approximately 200,000 Americans die each from preventable medical errors, including facility-acquired conditions. That's not specific to Americans. These facility-acquired conditions, you go in with one thing, come out with it. I went in with a broken arm, came out with pneumonia. Went in to have surgery on my toe, came out with SARS, right? So what happens is they're called nosocomial infections. You get them in the hospital, or issues. Sometimes they're the healthcare provider that shares that with you. So the Affordable Health Care Act in the United States has had great strides been made improving insurance coverage nationwide, and it's continuously getting better and improving the cost and quality of health care. So in the United States, the health care is provided by some organizations, care facilities, largely owned and operated by private sectors businesses, are usually where we go. So 58% of U.S. community hospitals are nonprofit. 21% are government-owned, 21% are for-profit. So despite being among the top world economic power, the United States remains the sole industrialized nation in the world without universal health coverage. Right? I realize there are coverages out there, but the sad thing is we need health care. So in 2013, 64% of health spending was paid by the government, and funded programs such as Medicare, Medicaid, the Children's Health Insurance Program, and the Veterans Health Administration. People age 65 and under acquire insurance through family members, employers, plans, health insurance on your own, or you're just insured. Find insurance. If you're young and healthy, find it now. If you're middle-aged, older, healthy, unhealthy, getting there, get it now before it gets worse. Your health insurance may exclude some conditions, so get as many in there as you can before you get them. Okay? So it can be sometimes costly to get health insurance, but talk to your financial advisor, right? For somebody you trust. Talk to your friends, family, coworkers. Find out what, right? Do some research. Don't just depend on things. The top 3 causes of death among males and females is in North America is cardiovascular disease, neoplasms, which are blood disorders, and neurological disorders. And it has been for the past 30 years. Chronic lower respiratory disease, so anything with your lungs, is also an issue. So in 2015, the total number of deaths by heart disease, 633,842. Sir, 595,930. Chronic lower respiratory disease, 155,041 people. Now, diarrhea, what the heck? That's just poop. Yep, disease. Diarrhea, low respiratory, and other common infections ranked 6th overall, but had the highest rate of infectious disease mortality at 31.65 deaths per 100. 31 people per 100,000. You think, well, that's not a lot. That could be you. And there's that a large proportion of health incomes and early mortality can be attributed to factors other than communicable or non-communicable disease. As of 2013, the National Research Council study concluded more than half of men who die before 50 die because of 19%, which you probably can't control, traffic accidents, 18%, and other accidents, 6%. That accident could be a healthcare accident. 53% of women before 50 because of disease. Disease. Women, ladies, not us. 38% died of accidents, homicide, and suicide. So if you're a woman in North America, 53 out of 100 of us who die before 50 died due to disease. We need health care. All of us need health care. The average hospital stays can be $100,000, and that depends on your condition. Definitely look into insurance, find out what it's going to cost, and see if we can't get all this stuff covered, because worrying about our health care is making us sick. The ACA, your Obamacare, people are required to have a major medical policy specific minimum essential coverage. You might have to pay a tax penalty if you don't have one. So look into that, see if that covers something. Right? Approximately 70% of people in the U.S. have health insurance through their employer, or make sure you know what it covers. Make sure you know what it doesn't. And seek out health care. Talk to somebody. Talk to your advisor. Find out if you can get a family plan. Could be a lot cheaper for you and could do more coverage. So on that note, let's go to our last break of the show. When we come back, we're going to talk about some health insurance companies in the United States and Canada that we can look at. And we're going to talk about staying and keeping healthy so that our health care doesn't make us sick. You are listening to Karen Cook on Financially Speaking on the Inspired Choices Network. We'll be right back.
Too many of us get caught up in the unreal lives of reality television and complete to acquire stuff, which is setting us up to accumulate lots of debt. We're scared, confused, and don't know who to talk to. By tuning into Financially Speaking radio show with financial advisor and educator Kathy Cook Noble, you'll learn tips you can use to improve your financial health, which in turn can improve your overall health and make for a very happy life. Live a life you can afford and enjoy. It is possible. Listen for Financially Speaking Radio Show every Monday at 4 p.m. Eastern Standard Time, 3 p.m. Central, 2 p.m. Mountain, and 1 p.m. Pacific on InspiredChoicesNetwork.com. This is Financially Speaking Radio Show with financial advisor and educator Kathy Cook Noble. To participate in the program, call in the U.S. 815-880-8255, Canada 613-800-8736, or Skype us at Inspired Choices Network. You can also make the choice to ask or comment by email by sending to Kathy at bookkeepplus.ca. Now back to the program.
Welcome back to Financially Speaking. I am your guest host, Karen Cook, today on the Inspired Choices Net, and we are discussing our health care and whether or not it's making us sick. So if you live in the United States, you're looking for some health care, you don't have any coverage or you're not happy with your coverage, you need more, want to ask some questions, you don't have a financial advisor, get on your internet and start Googling. And that almost sounds, doesn't it? Anyway, it might be, but there are some groups out there that we can look at. The top U.S. health insurance companies that I found are United Health, WellPoint Inc., Kaiser Foundation, Humana, AETNA, HCSC, Cigna Health, and Highmark. So they seem to be the more popular ones. So have a look, see what they cover, if it benefits you. Give them a call. Have your questions ready. Have your list of questions so that you know which company you're going to end up having. In Canada, the biggest insurance companies we can have a look at is Life, Great West Lifeco, Sun Life, IA Financial, maybe RBC, and Empire. They're just a few, and I'm sure there's plenty more. So find your financial advisor, the person you trust with your life, because you really are trusting them with your life. Speak to them about your medical insurance, what you're looking for, how much you can pay, or how much you're going to want to pay, what's best for you and or your family. And together you can find a program that's most suited for your needs. So how do we prevent getting sick in the first place, having that burden of our not-so-great healthcare system be financially straining on us? First thing is, eat plenty of fruits and vegetables. Choose to be healthier. It is a conscious choice. I don't like fruit and vegetables. Come on, there's got to be something out there you like. My dog loves peaches. We love peaches in the summer. I can't get over him, the little fart. He eats them up like they're going out of style. So even my dogs who hate vegetables found something. One likes strawberries, one likes peaches, one likes watermelon. So anytime I have fruit, I have all three of them so that we each get to eat what we like. Drink water, lots of water. It prevents dehydration. It flushes out your system. It cleans out your body. Water, water, water. Okay? Get enough sleep, 6 to 8 hours a night. It's crucial to maintaining your health. You look better, you feel better, your body gets the rest it needs. Get your flu shot. It's the number one thing you can do to prevent the flu. Because you know from our previous shows, and if you haven't listened to it, listen to it, the flu can kill you. I'm not saying mandatory, you have to go get it, but it is a recommendation. Wash your hands a lot. You go shopping at a shopping center, you touch the cart. Oh my gosh. You should really use a sanitizer, wear gloves, wash your hands when you get home, don't touch your face, don't bring it home to your family. You touch things when you're in public. Sick people touch things. People sneeze, cough, fart, burp, puke. It gets everywhere. Use alcohol-based hand sanitizers. Carry it with you. I have those little sticks. I carry them in my car, my purse. I have them on me at all times. When I go teach first aid, they're in the bag. You want to make sure you have everything on you so you can keep your hands clean, which keep everything clean. Don't get close to people. I realize if it's your family, you have no choice. But if anybody's sick, get out of there. If you're sick, please don't go to work. Keep your surroundings clean. If you're not so clean at home, clean your house. Keep it clean. Germs love dirt. Keep your immunizations up to date. When you've got your shots up to date, you're healthier. Yeah, I have to see my doctor in 2 weeks. I'm getting 10 years it's been. So, but it's going to keep me healthy. I'm okay with that. Watch your pressure. I know you think, what? You can go to your stores and you can use the pharmacy stores, a lot of the time, or Walmarts or supercenters, you can use the blood pressure cuff. Sit down for 5 minutes. Rest, take a few deep breaths, do your blood pressure. Okay? If you can buy them. I bought an automatic blood pressure one at a pharmacy, and I take it every now and then just to make sure I'm good. And by the way, 120/80-ish is norm for an adult, but see what your norm is. Pursue an ideal body mass. Talk to your doctor or a nutritionist, or check out the body mass indicator online. I checked it out last night. I got a little ways to go. Don't get caught up on the number. Your health, eating healthy, it will show on the outside. Keep safe blood sugar levels. Watch your intake of sugar, sweets, soda, chocolate. I know I'm making y'all hungry, and I shouldn't talk about that because then we all just we crave it. I do like sweets, but mine is caffeine-free Diet Coke. Woo! Right now, I usually have 1 or 2 a day. I try not to, but I do like them. But other than that, I drink lots of water, a little milk, and tea. So I'm not drinking too much. That's probably going to harm me. But it's not sugar. Again, got to watch the sweetener. And get moving. Exercise, walk, garden, play with your dogs, play with your kids. Do something. And for those of you that smoke, and I am an ex-smoker, try to quit. Some cessation aid free. You can get help. It's out there. You can get incentives. You can join the gang, right? Win $5,000 if you quit smoking. I didn't do any of that. It took me 6 months, but I'm smoke free now. Going on 2 years, close. But no, I'll never go back to it. Sure, I'm sure there are crazies, but nothing that makes me go, wow, I wish I had a cigarette. It out of sight, out of mind. And I not to be around places or people that smoke because I do love the smell of a freshly lit cigarette and a match. But other than that, no, I've really become kind of an ass because I think an ex-smoker is worse than a non-smoker. We know what we did. We know how we smelled. And now it's like, ugh, right? And keep pace with your health screenings. Men and women, breast and prostate exams, they're designed to catch the cancers in their very early form. Sorry about that. Tickle in my throat. So do what you can to stay healthy. Talk to your financial advisor about your health care. Eat, drink, sleep well. Try and live a healthy life. Just get up and move. 15 minutes a day. Just get up and move. Go for a little walk. Enjoy yourself. Next week, where your Kathy will be back, and we'll be achieving financial independence.
Thank you for choosing to listen to Financially Speaking Radio Show. Kathy Cook Noble will return next Monday at 4 p.m. Eastern Standard Time, 3 p.m. Central, 2 p.m. Mountain, and 1 p.m. Pacific on InspiredChoicesNetwork.com. We hope you'll join us. Until then, have the best week of your life by making the choices that bring you all that